Hello, friends. Good morning to the second edition of Ayurvedic case study discussions with Purnarogya Holistic Healthcare. Today we have a wonderful friend named Andrea who is presenting a case on skin diseases, psoriasis. Unfortunately, due to some technical errors, she is not able to join us. We won't be able to hear her voice, but I would like to express my gratitude, thankfulness to her for sending us this case, which is one of the very important cases that we find. Psoriasis is a very, very common skin disorder. In fact, the commonest autoimmune skin disorder in the United States. So today we will be discussing about this most important topic. First, we will just go through the case. I will read it out and take all of you through the case that we are discussing, and then discuss a little in general to understand about the Ayurvedic concept of skin disease. And then we'll go into the Nidana, Purva Rupa, Upashaya, Samprapti, and so on, as we usually do. And then discuss about the management. This time, I'm also going to give you some homework to do at home so that it will trigger your imagination, your understanding, your intellect to go deeper into the subject matter. So let's go ahead. Thank you. I'm going to share my screen with you now as we go through the case together. Complaints of skin disorder since 2009. So that was much before the divorce, probably. The date of the divorce is not given here. He has a history of shoulder surgery due to sports injury, history of methamphetamine use, alcohol. His diet, loves to eat a lot, is a big eater, excessive eating, irregular eating, incompatible eating as well, likes to mix things up. And I would suppose that he eats more than 3 meals a day. We can see here ice cream right after dinner. mixing dairy products along with fish and so on. So excessive, irregular, and incompatible eating is a very important nidana cause for skin disorders. Sleep pattern is irregular at times due to work schedule. Sexuality is normal. Other habits like playing under the hot sun, sweating. It would be worthwhile to ask him whether he has a habit of holding the natural urges during his job or during his playtime and so on, whether he has a habit of taking cold showers immediately after a game or after workout, or whether he has vata kapha aggravating kind of lifestyle activities. We saw some of them with regard to eating and so on. Possible nidana, according to Andrea, he has a pitta prakriti, build-up of pitta through rugby as a youth, and it is developed into a full-blown pitta disorder. Samprapti of the disease. So this is what we are just going through as per what Andre has sent me. Samprapti, pitta from sun exposure, hot climate, use of drugs, pitta prakriti. Pitta enters the dhatus, shrotas, finds the Kavaigunya, which according to Andrea is liver and blood, Rakta. Yes, I will go through that in a little more detail later. Roga Adhisthana. The Adhisthana of Roga is classified into two. Adhisthana basically means the basic foundation of the disease. It can be either the body or the mind. So it's important to know whether the disease originates from a mental affliction or the disease originates from a physical affliction. And in the examination, the pulse is regular, strong, warm, even rhythm. Ayurvedic analysis of pulse is not given here. Strong pulse, warm pulse indicates more of a pitta type. So we will assume that. Body temperature is warm. In the examination of sense organs, everything is normal except for the fact that he has a tendency to overstimulate the sense organs by watching television, music, loud sound. Nowadays, people have this habit of having music going on in the ears with the earphones, mobiles, and so on, which leads to overstimulation. Inspection of the skin lesions. There are flat patches, pink in color, sometimes becomes white and flaky. The location is in the groin area, back, arms, ears, nostril area, and other extremities. You will notice that I did not say psoriasis because we are discussing the Ayurvedic perspective of this particular skin lesion. The allopathic diagnosis is psoriasis, but we would like to come to an Ayurvedic diagnosis. Why? Because when we want to create an Ayurvedic protocol, it will help us to understand what is this disease from the Ayurvedic perspective, because all the protocols and all the medicines that are recommended in Ayurveda are done in a certain way, are done in keeping in mind that an Ayurvedic diagnosis and an Ayurvedic samprapti. Let's see. Physical appearance is 5 foot 5 inches, medium. Hair is coarse. The liver line on the face is prominent. Did you mean the line between the two eyebrows? I'm not sure what you meant. Dushyam. Dashavida Pariksha. Looking forward to learn more about dhatus. Okay. The dosha involved we already saw is pitta, as you said. There's a sour odor in the sweat, which indicates pitta. And gases in the colon is typical. That means the digestion is affected. Koshtha is affected. Agni is affected. There are vata symptoms like forgetfulness, overstimulation. So a vata and pitta involvement is also there. Desha, Bhumi Desha. Patient grew up in the hot climate, hot and humid. Anupadesha it is called. Deha Desha, the location of the disease on the body, head, back, arms, area of the legs, where the leg meets the torso, the crack of the buttocks. Yeah. So that is the location of the lesion on the body. Patient has good strength, immune strength, physical strength. He doesn't have any other problem except this skin lesion, generally doing quite well. He doesn't report any increase of symptoms in any particular climate. Hawaii is a warm climate, that's good. But what we are interested in column is whether the disease increases in any particular climate or not. It's not mentioned here. Analam, Agni. He has a very strong appetite. Agni is very strong. Hungry right upon waking. And we also saw that he sometimes feels hungry in the night, gets up in the night to have food, can snack a lot. As we saw earlier, that although he eats 3 times a day, I was quite sure that he also eats in between. So a lot of food being taken in. Tikshnagni, that means he has a very strong appetite but produces a lot of gases. That means the Agni is not really digesting what the appetite is very strong, but the Agni is not actually able to digest everything. Prakriti is Pitta, Pittavata, Guna, Ushna, Tikshna, light, Chala, moving, age is 36. Physical work during the day, sometimes in the sun, no smoking, a lot of exposure to the sun, okay, and a lot of alcohol intake, which adds to the samprapti, exposure to the sun and alcohol. Please note these. Nadi, like a pitta nadi, as we saw earlier. Mutram, abnormalities, no abnormalities. Mala, again gases, incompatible food combining. Sweat is having a sour smell and a lot of earwax. No constipation. Pitta imbalance generally tends to have less constipation. Jihwa, tongue is pinkish red, some teeth marks along the edges, yes, malabsorption, no proper digestion, no ama, no coating, that's good. Apart from that, the rest of it is quite normal. Conclusion is that he has a tendency to commit prajnaparadha. That means in spite of knowing that this is bad for me, he continues doing the same things. Aparadha or aparadha can also be called as a sinful activity. Sinful activity against one's own intelligence, prajnaparadha. It is the root of every sinful activity, prajnaparadha. When we do not listen to our inner intelligence that guides us. Mandal, your diagnosis is Mandal. Mandal basically corresponds to more excess of kapha dosha, while Udumbara corresponds to Pitta, as we will see later. Pitta dosha, Ama in the Rasarakta Mamsa. We saw that there is no coating on the tongue, so Ama in the Koshta is not so much, but Ama may be in Dhatus, Brajaka Pitta. So is there any particular symptom or reason why you say that Brajaka Pitta is affected? Is there a lack of luster on the skin? Is there any particular symptom related to Brajaka Pitta. Cooling, calming, grounding. Treatment principles: cooling, calming, and grounding, containing the fire, encouraging sattvic quality to the mind, meditation, so on. So far, the treatment, the result is that removed a lot of things from his diet: coffee, drugs, hard liquor, fried chicken, spicy foods, and so on. Added fruit, sweet drinks, watermelon, apple, pear, grapes, and so on. Introduced behavioral changes: drinking beer instead of liquor, although it's very difficult for the patient in during social events and so on. But he has managed to cut down on the alcohol consumption. Daily application of coconut oil has wonderful results, has reduced the irritation. Neem and turmeric capsules are being given. So there is some progress. Now the skin has gone from white scaly to red inflamed to pink to normal skin. Feels soft like baby skin. So that's very good that he has improved a lot. Andrea would like to use Praval Panchamrit, Kamadudha with Moti, and Arogya Vardhini. These are commonly used in skin diseases, liver correction, Rakta Dhatu vitiation, Pitta correction. So, neutralizing the Visha, the Dushi Visha, the undigested toxins in the body. So, we will discuss about that as we go ahead. The treatment has been somewhat successful, but the patient admits he still wants to feel the fire via his rugby participation, a competitive contact sport. Patient continues to associate socialization and male friendship with drinking alcohol, although he understands that this flares up his psoriasis. He's slowly trying to work on that. So it's treatment has been working quite well and it's doing quite good. We will go ahead into our discussion about Ayurvedic skin disease. I'd like to share my